We have a variety of different modules with different assessments. So like I said, we have a case formulation. We also have a risk assessment. Similarly, they would be given a case and they would have to assess the level of risk that they have based on different factors such as static risk, dynamic risk, and all those factors and how they play a part and what is the correct practice that should happen. So where should they be? Should they be in high secure, medium secure, low secure, or community-based prison? And that's a decision making that we teach based on how to assess risk. We have to also understand the BPS and the HCPC framework, which is the guidance for working in practice. And students would be made aware of that and they would understand the key ethical tensions and frameworks such as respect, autonomy, at the same time as duty of care, and also making the best decision in the best interest for their patients or the clients. And that is another assessment that we do. And we also have research methods report, quantitative methods, qualitative methods. Now, quantitative methods looks at the more statistical side of data collection, data analysis and interpretation. And then we also have the qualitative side, which is again, collecting data qualitatively, analyzing it, interpreting it. But there's a huge focus on clinical judgment, clinical reasoning and clinical evaluation. So when our students go out there, they are fully aware of how to work with different situations, be it data, be it practice, be it risk, and how do they manage that and how do they make the best clinical judgment, interpretation and judgment of a situation. There's a huge component of it is independent project, where students learn how to write and disseminate independent research. So they'll choose a topic of interest within the forensic psychology and mental health. They'll have support to develop that into a dissertation. I think this course is recommended for all students who have an interest in forensic psychology and mental health. It builds on theoretical concepts that you know, and it's also about making sure that you're ready for practice. We are always thinking about employability. We're always thinking about the next step. So it's not just about going into a job. It's about making sure that we're getting you prepped, ready for academic route, which is PhD or further education, but also professional doctorates in forensic psychology and mental health. Our focus is on building skills, building knowledge, and building a sense of community. What we want to do is we want to instill you with knowledge. We want to instill you with skills, the softer skills such as presentation, group work, that are central to the practice of forensic psychology and mental health. But at the same time, we want you to enjoy the course. The course has been developed with students in mind. We have taken steps to understand what students need, what students want, and what does the future look like for students? What does forensic psychology and mental health look like as a field? And where is it going? So this course has been developed with real knowledge of where the evidence is, what the student needs are, and how would we use forensic psychology and mental health in the future. So this is not just for a course for now, it's a course for the future. And with constant development of the course, the refinement and the course quality monitoring of the course, that's where we differ. So my favorite module on the course would be the forensic mental health and the criminal justice system module, purely because it's purely assessment driven, which is a case formulation. And with my background in forensic, clinical and social psychology, it brings all my areas of expertise and my interest areas together. So I really enjoy understanding what is the forensic risk here? How is that motivated by the mental health components, so the mental health of the patient or the client? My recommendation, obviously adolescence is one of them. There are quite a few. I tend to go for more international cinema as well. Anything related with crime. I've been watching, or I have watched the early series, and there's currently one at the moment about the Indian Predator. And it talks about the reasons why somebody has become a criminal. What were the situations? What was the sociological events that happened? What was their psyche? What was their upbringing, attachment? Everything that we cover in theory was actually shown as these were the fundamental factors that led to the criminality later. And it was really interesting because I psychodynamically inclined, I think the first 7 years become the script, and that is the hidden emotions, thoughts, ideas, schemas, the unconscious processing or the subconscious processing of how we behave, and that how it manifests later on in life. So somebody would have no risk at all, and all of a sudden they have a trigger, they exacerbate, and there's criminality, they become engaged in an offense. Where does that come from? earlier years, the script may have been written, but it's only later on in life that it's come out. So there is this whole idea of psychodynamic is a little bit non-falsifiable. There's no way of testing it. But from a purely psychodynamic and from that kind of thought where there's subconscious, unconscious, I believe there are some scripts that we learn, things that are repressed, which do come out later under the right situations, under the right circumstances, under the right triggers. We're all potentially capable of things that we didn't think we were capable of.